My name is Dr. Yetta McCullom, and I'm a periodontist. So basically, I save teeth. I help people keep teeth for a lifetime. That's my goal. And most people, when given a choice, would prefer to keep their own teeth instead of having to lose them. I also help people keep and maintain their implants now, because so many teeth are being replaced by dental implants, and they too can develop problems. So periodontist basically means that I take care of everything around the tooth. Well, the Chicago Dental Dream Team is a phrase that we use. We're basically two practices, Drs. McCullom and Dr. Robin Ferguson. So we're two separate businesses, but we like to use that term dental dream team. You kind of think of Dr. Ferguson, she's the general dentist, she's like the quarterback. She kind of lays out the plan. A lot of what we do is treatment planning together. How can we help this patient reach the goal of a beautiful smile? A lot of times there's a lot of background work with that. And Dr. Cornell and I do that background work. We make the mouth healthy. That's what I do. I treat whatever active gum disease there may be. Dr. Cornell will remove any teeth that can't be restored. Dr. Ferguson too restores teeth, does fillings, and ultimately she provides the smile.
My name is Dr. Robin Ferguson, and I am the general dentist for the Dental Dream Team. If you have a patient that comes in that needs to have gum treatment or an extraction, or I need to prepare a tooth for a crown, we can usually work together on that patient, sometimes on the same day, so that we're able to take care of that patient's treatment completely. Instead of having that patient to go across town and then come back to your office, it's right here within the office. And patients really appreciate the convenience of everything located kind of under one roof.
My name is Myra, and I've been with the team 15 plus years. I love the concept of having different dentists in the same office space so that you can move easily from one to the other. I've used Dr. Ferguson for caps, and I've used Dr. Cornell for extractions and implants. Every 3 months I have a cleaning with Dr. Yetta McCullom.
Myra had a situation where she had some really great implants done. She developed a bit of an infection around the implants. Once upon a time, I would have to cut the gums, get in there, clean off the implants. I was able to do a new procedure called LAPIP, laser-assisted peri-implantitis procedure, on Myra, so that I was able to help manage that infection for her by just doing the laser procedure around those implants instead of a more invasive type. So it's really nice for me to have this technology that makes that care a little easier on the patient.
I have 9 implants. Dr. McCullom put the implants in, and then Dr. Ferguson put the caps on the implant. But I just like flowing from one room to the other, and I like that when you're there that the dentist will conference if they got a question, and they will have a talk.
So we all do come together, share our ideas, share what we think is going to be the best treatment plan with the patient, and together we come up with a treatment plan that's acceptable and going to be successful in the long term.
My name is Cornell McCullom III, DDS, MD. I am an oral and maxillofacial surgeon and a physician. When patients come to our practice, I'm not seeing them alone. So we have doctors' meetings to review the cases, to run through different options and plans, to agree with certain plans, to disagree with certain plans, and we've been doing this for 12 years. So we have a good working relationship. With my wife treating periodontal disease, if there's teeth that she can't save, we can plan beforehand on how to replace them. And if there's teeth that are questionable, usually she'll put in a good solid effort to try to keep those teeth. With the 3 doctors, we have to work well together, and we have to do things well because we know we have someone else checking us, looking over our shoulder.
My first name is Gina. I've been seeing Dr. Yetta I believe maybe about 2.5 years. We're going on 3 years. And I knew that I needed to have something else additionally done with my gums. But I didn't want to have it done the way it was done the first time. There was too much pain involved and too much cutting, and anyway.
Many people suffer from periodontal disease. The recent data coming out shows that over half of the population suffers from some form of periodontal disease. Hispanic Americans, African Americans, the elderly, lower socioeconomic people suffer at greater rates than even 50%. So it is a very common human condition. And the question is, how is it being evaluated? How is it being treated? Fortunately, not every person with gum disease is going to progress to that loss of tooth situation, but there is that small percentage that will progress. And at this point in time, the only way we have of knowing this is by this constant comprehensive periodontal examination. So everyone should have that. It really is a public health issue.
Make us your wise choice. Choose the Dental Dream Team.
I heard about her on the radio. They said you could see her video on YouTube. I went to YouTube and I saw her, was very impressed with everything. The team and the surgery was explained, the laser gum surgery, and there was a free consultation. And I run from the dentist's office, but I knew I had to do something. And so I went, and they were great. How they welcome you, the office staff is very warm. They really do, as much as possible, make you feel at home. if the dentist's office is a place like home. But it's not a place that I'm afraid to go to. And that's very important, I think, I know for me.
She had had the surgery done before with the suture and the cutting and the suturing, and she didn't want to go through that again. So she came to me a little disheartened because she had to make a decision, either lose my teeth or go through that surgery again.
I kept reminding her that the surgery before was like A, B, C, and D, and this is what I didn't like about it. And she kept reminding me that those points that I brought up were not going to happen during this surgery. And she explained from beginning to end what was going to happen. Yeah, there wasn't going to be any, deep cutting of the gums, and there wasn't going to be the pain, that goes along with that kind of surgery. There weren't going to be any stitches. These are the things I was afraid of. And so she addressed everything that I brought up that I felt afraid of. She addressed every one. And I felt more confident about moving forward. Not that I wasn't afraid at all anymore, but I felt better because this was going to be different.
I was able to treat her with the LANAP procedure, laser-assisted new attachment procedure. And she was very happy, and the results were exceptionally good. She's very good about keeping up with maintenance. We're both happy with the results up to this point in time, and I think she's about 3 to 5 years post LANAP procedure now, so it's holding up well for her.
For maintenance, I go in for cleaning every 3 months. Previously, after I had the first gum surgery, it was not a good experience. I had to be injected and with local anesthesia every time, and it was just not good at all. But I don't have that this time, and I'm so happy, and that's the only reason why I go in every 3 months is because I don't have to have injections just for deep cleaning. After every appointment, they call, 1 or 2 days ahead of time to make sure that you know that you're supposed to come back in. And it's interesting, they make you feel like you're part of the family.
A lot of people have had bad experiences with gum surgery. But what I'm so pleased about is the technology that has changed the way I'm able to help patients manage their periodontal disease, because I do this procedure called LANAP, laser-assisted new attachment procedure. And so I no longer have to cut, suture, do bone grafting, use membranes, and do all of this fairly invasive surgery to help save the teeth. I can use my laser now, and it's made my life better. It's made my patients' lives so much better. When I have patients that need retreatment, say they've had the old school surgery some years ago, and now they come in and I do the LANAP procedure, it's night and day. And they're very pleased. And my results are similar, if not better. Sometimes I have to go back to the blade with the cutting, but it's very minimal at this point. So the technology that has entered into my specialty, which is the periolays and the LANAP protocol, has just changed my practice profoundly.
Make us your wise choice. Choose the Dental Dream Team.
Sometimes medical professionals will speak to you in kind of a condescending, intimidating way when they're telling you, oh, you should have that. But she never did that. She just gave me the option. She said, this is where we are. I'm very concerned about your health, the health of your gums, and this is an option I'd like to see you move forward with. So from that point, I went to another room and saw a video of what it was going to be like to have that kind of surgery from beginning to end. And I really appreciated that because that helped.
I do believe that LANAP is the gold standard for treatment of moderate and aggressive periodontitis and chronic periodontitis. I think it should be the #1 option of choice for patients. I feel that the tipping point has been achieved. More and more periodontists are getting training and getting this procedure. Patients are asking for it. People are out here on YouTube and Googling and they know about it. So yes, the LANAP procedure, in my opinion, is the gold standard for the treatment of periodontitis.
I just feel like that you matter, you know, and they treat you like you're special. Everybody's a VIP there. And it's just been a good experience, yeah.
You know, I find it very interesting when patients come in here and they're really willing to put their money where their mouth is. They've reached that point in time where either that front tooth is shifted or they've been taking care of everyone else for so long and now it's time to take care of themselves, and they're very happy with the decision. It's nice when you're able to really take care of yourself and invest in your own self, in your own health. And people seldom regret that. They see immediately the difference in how they can interact with other people. They're no longer holding their hand over their mouth and they're more comfortable. The job interview could go a lot better if someone's comfortable and smiling instead of, you know, kind of reserved and not. When people do put their money where their mouth is, it's a very good investment.
The reality is a person has to make the decision that they're going to make the sacrifice to get this done for themselves. It was a me choice, and you know, I have family, and there's all the things that we do for our family. Sometimes we should think more of ourselves and take better care of ourselves, but it's always about the family, you know. And so at this point here, I was facing something where I said, you know what, I'm going to have to make this sacrifice, you know, and it was worth every penny. It really was. I have a much better smile, you know, I still have my gums, they're very healthy, and yeah, I'm very grateful to the Dental Dream Team and to Dr. Yetta for what she's done and her staff. Every smile is worth it.
The type of patients that I usually see are the full gamut. I mean, it could be someone that needs just a simple filling, someone that just needs maybe a little bleaching, a little brightening of their smile, or it can be a patient that needs to be completely restored. Give them their smile back. Sometimes patients come in and their hands are covering their mouths and they don't want to smile, and they're tight-lipped, and you look at the pictures that they bring in and no one's smiling. So I kind of give them their smile back. I want to make sure that they walk out, not the way they came in with their hands over their face, but walking out with a full smile, because it's very important. It's a lot of satisfaction in that.
My name is Alice, and I've been going to the Dream Team about 5 years. I have a horrible history with dentists. I mean, that's why my mouth was so bad. It's from a child, so I don't like the dentists at all. The day that I walked in, my dental work was, my teeth were crooked. Because I had lost so many teeth prior to that, the teeth had slanted. So I didn't have an attractive smile at all. And that's what I was trying to get back.
So many times patients come in and their self-esteem is low, and it's only because they're not happy with their appearance. They're not happy with their smile. And you know, a smile can either age you 10 years or it can take 10 years off of your life. So I think the biggest joy I get is when I take those pre-photos of the patients. It's about 10 or 12 photos that we take of the patients. And as we go through treatment, I occasionally pull those photos up and the patient's like, oh, I can't believe I look like that, you know, even though they're in temporaries. And then toward the end of the treatment, once we've finished everything, we take the post photos and the finished photos or the glamour shots, and we put both of those photos up, the before and the after, and the patients are just amazed. And you can just see their personalities changing from this introvert, kind of shy, timid person to this very outgoing person, or this totally different personality.
I first saw Dr. Ferguson, and she looked at my mouth and she felt that we could do implants. But before we could do the implants, I had to go to an orthodontist, and he was trying to straighten the teeth out. I went to the orthodontist. That was like a 2-year work, and then after that, I went to Dr. McCullom, and he did the implants. And then the third step was Dr. Ferguson, and she actually did the veneers on the implants, for the implants.
When she first came in to see us, she was very upset. She was totally turned off by the dental field because of how she was treated. And she had had a lot of different care. She had moved from state to state, and there wasn't a consistency with treatment, and so it was kind of like, well, let's fix this tooth, let's fix that tooth, where it wasn't full comprehensive care. A majority of our patients come in and say, well, just fix this tooth, and that's not really the answer. We need to do full comprehensive care. We can come up with a full treatment plan. We can take one tooth or one section at a time, but we need to come up with a full comprehensive care of treatment in order for you to get healthy. And that was my biggest hurdle with Alice, was to convince her, you need to do this full comprehensive care. So for her, full comprehensive care required that she get braces, orthodontic treatment to straighten her teeth out, as well as correct her bite. You know, I can put all the veneers and crowns on teeth, but if the bite, the way your teeth come together, if it's not properly matched, then all that beautiful work will be for naught. You'll crack it, you'll break it. She went through the ortho. Once her bite had changed, she immediately felt better, because even though all the teeth weren't perfect, they were aligned. She was smiling, she was eating better, so she was feeling good about the whole process. And I think that's critical. Once you can get a patient over that hump or that anxiety or what their concern is, then you're able to treat them, and you know, the process goes pretty smoothly after that. So she's had quite a bit of work, from orthodontic treatment to implants, crowns, veneers, laser treatment. She's had the full gamut, so she's in good health.
It is a very costly expense, there's no question about it. This is an investment for your entire life. You would spend the same amount of money on a car or something that's going to depreciate. This is not going to depreciate, by no means. And it is an expensive deal. I mean, there's no question about it. But I definitely think it's worth it, because it's with you for the rest of your life. You're eating better, you're eating things that you should be eating, that you probably were not eating before. And I did not eat nuts, or I didn't like a salad, because it was difficult for me to chew it properly. But now I eat the salads and I eat the nuts, which are beneficial to me.
I think a mouth is very important, of course, not only because I'm a dentist, but it allows you to eat properly. It allows you to function properly. It's just very important no matter what age you are, whether you're 15, 16, 30, 40, 60, 70, your mouth is important. And so it really should be taken care of. That's one of the first things that people look at, is your smile.
It's a great experience, they're great people. I love my smile. I really like my smile, and it's worth it.
Make us your wise choice. Choose the Dental Dream Team.
My name is Donald, and I've been going to the Dream Team for approximately 14 years. I had a few teeth that fell out because of gum disease, because I hadn't been really doing regular checkups, just only when I had a pain. I heard about them through Dr. Robin Ferguson, because I was going to her at one point when she was working for the University of Chicago. I needed some surgery, so she introduced me to Dr. Cornell McCullom. I was fearful at first because I had to have major surgery. Dr. Cornell, he calmed me down and he told me everything they were going to do, and we proceeded through the procedure, and everything was fine.
He had a significant amount of treatment done. He had a lot of bone loss, so Dr. Cornell had to add bone due to gum disease.
It was worth a lot more than my money because I had a partial, and I couldn't really even taste my food with the partial, so I got implants. So it was more than worth the money. I have no regrets about the money I spent. I was in pretty bad shape before I started going to them, and I would say they improved my teeth and smile probably about 90%.
A person can get the smile they dream of in a variety of time frames. It really depends on each individual situation. It could be anywhere from immediately, because sometimes we can remove a tooth, place an implant, and put a temporary tooth on that same day. Other times, we have to let things heal, and then a person can get the smile they would like or the smile they want, which may take 4 months or 5 months. And then in more involved situations, it may take up to a year, sometimes even a year and a half. But I'd say on average, anywhere from 4 months to about 10 months. So it varies from person to person.
My name is Nick, and I've been going to the Dental Dream Team for about 5 years. I've been treated there by all 3 doctors, Dr. Yetta McCullom, Dr. Cornell McCullom, and Dr. Robin Ferguson. I went to Dental Dream Team to have my front tooth extracted because I needed an implant. So I went through several procedures to get that accomplished.
I saw Nick a few years ago. I can't remember exactly, it was about 4 or 5 years ago. And Nick was a middle-aged male who had a tooth in the front of his mouth that hadn't come down all the way. So what we did was a procedure similar to the fast ortho, where I kind of softened the bone around the area. I don't know if I should get technical, but made a few little corticotomy cuts or little cuts in the bone so the orthodontist could bring the tooth down. So once he was able to do that, we were able to place the implant and finalize Nick's smile and finalize Nick's situation.
For me, I mean, this work I had done with the Dental Dream Team was not your basic hygiene for my teeth, for my mouth. And it was important for me because my previous dentist said that if I did not get this work done, there could be substantial damage done to my mouth and I could lose other teeth. So this was really a no-brainer for me. I wanted to preserve all of my upper teeth. I had to get this work done, so it was important for me to go to a practice where people knew what they were doing.
A dental implant is a titanium post. It basically looks like a screw that's placed in the bone, the upper jawbone or the lower jawbone. And when it's placed, it has a secure friction type of fit, similar to if you place a screw in wood. If that same patient came back a week later or 2 weeks later, I would be able to unscrew that implant. But after 4 months, the bone has integrated or fused enough with that implant that I would not be able to unscrew that implant. So there is that healing period that's required for an implant to integrate with the bone to make sure that it's solid enough to support the stress of a tooth and chewing over a period of time. So a dental implant is not the actual tooth, but it replaces the root of a tooth. So it's a support for the teeth. So kind of like the foundation.
My name is Ron Laurent. Well, I was, men don't say frightened, but I was frightened. Number one, I didn't know much about implants, and I had a lot of concern about the process, the product, pain, what I would go through with these implants. So I knew virtually nothing. So I came in and met Dr. McCullom, and I was immediately at ease after the conference because he was very clear and forthcoming in explaining what implants are, what the process was, and what the possibilities were.
What I like patients to come away with after becoming a part of our practice or team or family is that they got an education while they were here. They learned something about dental health, about oral health, some of the technical parts about what the procedure actually involved and why we were doing it, rather than just accepting whatever treatment we propose. So I want them to be part of the process because it is their mouth and it is their health. And I like patients just to be happy, you know, to be able to leave here and say, you know, that wasn't that bad. And we actually, I see a fair number of patients that do come in with that fear and that anxiety and that phobia where they're like, I've never had anything done without going to sleep. But yet they decide to go through this procedure and without having the sedation and just going to local anesthetic. And when they leave, they're like, wow, that was it. I did it. I made it through. It's like I could have done this before. So, you know, that's a good feeling to me because it shows that I was able to at least calm them enough and work on them, have them comfortable while I'm working on them and have them happy when they leave.
The implants that I have feel like real teeth. You don't really feel your teeth. There's something there, but that's what they feel like. They don't feel different. They feel just the same as all the other roots because an implant is the root, not the crown. And that root feels just like all the other roots. And in terms of care, the same care, flossing every day, brushing of the teeth, the maintenance is the same. And mine, the process started in the fall of 2003. It was completed 18 months later, which would be 2005. And they have held steady, firm ever since.
When people leave here, I want them to feel like it was worth it, that the money that they've spent has been worth it, that they feel that they've been given the service that they expected, that they want to refer their friends and their family. It's worth putting their money where their mouth is, and every smile is worth it.
Make us your wise choice. Choose the Dental Dream Team.